Hi, I'm Piper Harris, licensed professional counselor and founder of Untangled Mind. I want to tell you why I built this tool before I show it to you. I've spent years developing a structured, measurement based approach in therapy, one where assessment data actually drives treatment decisions, not just sit in a chart. And what I kept running into, both in my own practice and in training other clinicians, is that the gap between collecting data and doing something clinically meaningful with it was enormous. Not because therapists don't care, they do, but because translating scores into problem lists, treatment targets, and interventions takes a lot of time most of us simply don't have. I'm so passionate about measurement-based care that I've created a 5-hour continuing education seminar on it through online CE credits, because this approach needs to become a standard in our field, not optional. That frustration built this tool. It's not a diagnostic instrument. It's not a replacement for your clinical judgment. It's the bridge between your assessment data and your treatment plan, built by a clinician for clinicians. Let me show you how it works. You'll find the assessment engine on my main website, untangledmind.net. In the navigation, click on Clinician Tools and select Assessment Engine. This is where you'll find everything about the engine, what it does, what it's included, how it works, and when you're ready, all you have to do is select Become a Founding Member and select this button. This takes you directly to your secure payment screen powered by Stripe. Enter your name, email address, and payment information. Click Pay and you're done. You'll immediately see a confirmation message letting you know your account will be activated within 24 hours. Your account access and getting started instructions will be sent to the email address you used at checkout. That's it, simple and secure. I'll personally activate your account within 24 hours and you'll receive 2 emails, a welcome email and a getting started guide walking you through everything you need to know. Once your account is activated, you'll receive a login link. Click it, set your password, and you'll land right here, your Untangled Mind Assessment Engine dashboard. You'll see your name at the bottom left confirming you're logged in securely. Everything you do in here is private. Only you can see your client data. From here, you have 2 options. Begin here to start entering assessment scores or visit the Untangled Mind Clinician Tools page for additional resources. Let's select Begin here. Here is the heart of the engine. Before we dive in, a couple of housekeeping items. Although the assessment engine is housed within a system that has a BAA agreement, the HIPAA cannot be fully guaranteed. For that reason, all client identifiers must be anonymized. Use initials, a case number, or any code that is meaningful to you but does not identify your client. Never use a full name. The second thing to know, your client identifier must be inputted exactly the same every time for the same client. The engine uses that identifier to link all of your assessment entries together into one clinical picture. One extra space, one capital letter difference, and it will create a separate record. So decide on your format and be consistent. Now you'll notice that assessments are entered one at a time. I know that might feel tedious at first, but there is a method to this. Each assessment entry immediately generates its own interpretations, severity signaling, clinical cues, and pairing recommendations. And as you add entries, the case summary below builds in real time, giving you a layered, cumulative clinical picture that gets richer with every score you add. One more important note before we get started, and this one matters clinically and legally. The assessment instruments included in this engine are not owned by Untangled Mind. They are publicly available, validated measures developed by their respective authors and research teams. Some are fully open domain. Others are copyrighted instruments that require you to obtain your own authorized access before administering them. The engine does not change, modify, or interpret the assessments themselves. It simply provides a structured interface for you to enter the scores from assessments you have already administered using your own authorized copies. You are solely responsible for ensuring that you have appropriate access to each instrument that falls within your scope of practice and licensure, and that you are administering it according to the developer's guidelines. Regarding severity, where the instrument developers have established validated severity bands, these are used directly. For instruments with threshold scores, interpretive bands are used. However, these are reference points to support your clinical formulation, not diagnostic thresholds, and not a replacement for the author's interpretive guidance or for your professional judgment. All right, now let's look at how this actually works. Okay, let's get started. Under assessment name, simply scroll through the drop-down menu and select one of the assessment instruments. Currently, there's 22 within the engine and more will be added. Input your score and add any clinically significant notes you'd like to have within the engine and submit. Now let's scroll down to see the different tables that are filling for you as you go. First is a case formulation table. You'll see here is your client identifier, the assessment you chose, and your score. In addition, it tells you the domain of which the assessment is part of. It tells you the severity range, and it also gives you clinical cues. What else to consider? Different clinical cues and including different instruments. Below is your case summary. This is based on the data that Untangled Mind has acquired through their data-driven approach. What this allows you to do is get an estimated timeline of your structured sessions. Again, it shows the highest severity so far that you've seen. It suggests 10 to 14 sessions if you use a structured CBT protocol, and again, it tells you about the elevated domain. Now, what's important is each time that you put a new assessment in, you need to go to treatment suggestions. This populates to assist you in building your treatment plan. It's a different population with every single assessment, so make sure you have a copy and paste function that you can take these presenting problems, treatment targets, or recommended interventions and paste them into your treatment plan. All right, let's add another assessment. It does take a moment for it to populate below, but there it goes, nice and fast. Here you can see our second assessment is showing your score. The domain is depression. It tells us that's a severe score. It tells you some of the clinical cues that you need to consider, as well as different instruments that may help you get a deepened clinical picture. Case summary has now changed. The case summary goes based on the highest severity level. So you can see the estimated sessions has increased. This is again due to the data that Untangled Mind has assessed over the last few years. Your estimated session duration will be different than my own. However, this gives you an estimation that's great to be used for your good faith estimates. And finally, you can see here under treatment suggestions, these have populated again based on the depression domain. Make sure to copy and paste your presenting problems, treatment targets, or recommended interventions. You will find that there's some redundancy in many of these, and I will be continuing to add more presenting problems, treatment targets, and interventions as time goes on. Copy and paste those that make sense into your treatment plan that are relevant to your client that you're working with. That's it, the Untangled Mind Assessment Engine. Thank you for watching. Are you ready to get started? Become a founding member today at untangledmind.net/assessment-engine. Are you looking for more clinical tools? Visit untangledmind.net/clinician-tools, where you'll find assessment scoring toolkits, client treatment plan templates, and more, developed by me, Piper Harris, licensed professional counselor, to support measurement-based clinical practice. If you have any questions, please email us at info@untangledmind.net.